Hi again, welcome back to Mediplacebo. In this video, we'll be studying about uterine fibroids. So, fibroids basically, to understand the concept or the origin of fibroids, we need to take a look at the layers of uterus. That is, we have the outermost, that is the perimetrium, the middle layer, that is the myometrium, and the innermost, that is the endometrium. The middle layer, that is the myometrium, which is made up of smooth muscle cells, is from where the fibroids or the leiomyomas originate. And the endometrium is the layer from where the endometriosis pathology originate. Um, so fibroids basically are the neoplastic benign monoclonal tumors derived from distinct progenitor cells. It could occur at various locations, and based on those locations we could have distinct progenitor cells. uh, Metastasize to other parts of the body, but usually is localized to the part of myometrium of the uterus itself. And also, other fact about fibroid is that it is the most common cause of the gynecological tumor. Based on location, we can classify the fibroids either as intramural, that is within the uterine wall. So here the highlighted in B are the intramural, that is within the uterine wall. Then we have subserosal, that is serosal, present at the serosal surface of the uterus. So here A are the subserosal fibroids, and the third one which we have is the submucosal, which is present beneath the endometrium. So here it is present just beneath the endometrial lining, which would be present usually in this layer. So these are the three major types. Apart from it, we also have the fibroids of broad ligament. We also have the cervical fibroids, and we also have something called as submucosal pedunculated. That is the subtype of the submucosal fibroid itself. Out of all the three major types of fibroids, the subserosal is one which we uh, tend to find the irregularity of uterus in, compared to the submucosal as well as the intramural. And because it is constrained by the uterine tissue, whereas the subserosal, since it is present outside of the uterus, that is on the outer aspect, it tends to create an irregularity, as we can see here. Whereas in case of intramural and submucosal, since it is present within the uterine cavity, it does not tend to show any irregularity of the uterus. This is the major thing which we need to know about the subserosal thing. Uh, the symptoms which could present with fibroids would be constipation. It is usually the posterior fibroids here, the posterior fibroids which would exert pressure on the colon and could lead to constipation. Also, there could be the irregular enlargement, could lead to the pressure on surrounding organs, the neighboring organs, and that would lead to increased pelvic pressure. The irregularly enlarged uterus is determined by the bimanual pelvic exam. So here we can look at the bimanual pelvic exam to determine the change in the uterus, uh, to appreciate whether if it is regular or irregular uh, size of the uterus. So the bimanual pelvic exam here, the thing which I have inserted the picture of is a radiological probe which is being inserted into the vagina, but instead of it we usually use our hands, and try to appreciate whether if it is regular versus irregular uterine size. There could also be other symptoms like abnormal uterine bleeding. There could be other if the submucosal as well as the intramural fibroids are present, then there could be reproductive dysfunction, because it is the intramural and the submucosal is present around the endometrial lining, and this could lead to infertility like issues due to not being able to having space for the zygote to develop. Uh, the other thing which we have in contrast to irregularly enlarged uterus, we have also something that is uniformly enlarged or regularly enlarged uterus, which is adenomyosis, or could be also in case of pregnancy as well. So here we could appreciate the presence of uterus, which is present between the rectum and the bladder. So here we have the anterior aspect of the body, going from the bladder to the uterus to the rectum posteriorly. Some things about fibroids. It is the estrogen sensitive neoplastic benign tumor, and its size increases during pregnancy due to the high levels of estrogen, whereas its size decreases after menopause due to reduced estrogen levels. Also, it has an increased incidence in the black population, and they are more likely to develop fibroids at a younger age. Usually, the patient presenting these symptoms would be a younger patient, which could present with the pelvic pressure like symptoms, constipation, and abnormal uterine bleeding. So, here we can have a look at the irregularly enlarged uterus. Uh, it is basically generally a fibroid itself, which is present. Also, tends to have large and more numerous fibroid, experience more symptoms compared to other populations. It could be either due to the genetic aspect, hormonal aspect, or the environmental factors. A case presentation of uterine leiomyoma or fibroids would be like a nulliparous woman comes to the clinic due to pelvic pressure and constipation, and she is having menses which is without heavy bleeding or severe pain. Uterus and normal rectal tone. So you need to diagnose that based on the irregularly enlarged uterus, which has been mentioned in the stem of the question. It would be pointing towards uterine leiomyoma or the uterine fibroids. Other thing which is important in terms of licensing exams is the presence of the histology. Basically, as we know that the myometrium is made up of smooth muscle, so the whole smooth muscle, as we can appreciate here, the layers of smooth muscles which are whole pattern in with well demarcated borders, is the histology which we need to uh, remember in terms of leiomyoma fibroids. Is it's easy if you remember that myometrium is the layer from which fibroids are originating, and we tend to know that myometrium is made up of smooth muscle cells. So we have covered the concept of fibroids here, uh, and that is it for this video. If you like the video, please like, share and subscribe, and if you have any doubts, please let me know in the comments below. Thank you.